They call it the news. It's meant to inform you. But do you ever really feel informed? Here, we look for the signal in all that static. I'm Caesar, and welcome to Strange Frequency. Tonight's first segment, Pharmaceutical Advertising in America. If you watch television in the United States, you've already seen it. A smiling couple walking through a field, a father playing football with his son, a woman hiking through a mountain, and then the voiceover begins. Ask your doctor if this drug is right for you. And while the image stays warm and comforting, making you feel real good inside, the voice quietly lists the side effects: depression, seizures, stroke, organ damage. And then the music swells, the brand name appears, the commercial ends. Because in the United States, medicine is not only prescribed, it's marketed. Direct-to-consumer pharmaceutical advertising is extremely unusual globally. In fact, the United States and New Zealand are the only two countries where prescription drugs can be advertised directly to the public. That means pharmaceutical companies in America can promote specific medications directly to patients through television, social media, online advertising. The industry spends billions of dollars doing this. A large portion of that spending is directed toward consumer ads. These ads introduce the public to brand name medications before the doctor ever enters the conversation. Studies show that when patients see these advertisements, they are more likely to ask their physician about the specific drug they saw promoted. In other words, the patient walks into the appointment already carrying a suggestion. Doctors report this happening quite frequently. In physician surveys, patients regularly request medications that were featured in television or online ads. And sometimes, those medications are not the most appropriate for their situation. Critics argue that these ads can emphasize benefits while minimizing risks. They can also encourage treatment for conditions that might otherwise be handled through lifestyle changes or alternative approaches. And that raises an interesting question, because once advertising enters medicine, something subtle begins to happen. The definition of illness can slowly shift. Here's what we know. Advertising exists for a reason: to increase demand. And pharmaceutical advertising is no exception. If billions of dollars are spent promoting medications to the public, the goal is not simply education. The goal is utilization. More prescriptions, more brand recognition, more long-term customers. And that changes the cultural environment around healthcare. Medication stops being purely clinical. It becomes consumer adjacent, a product category. And once medication becomes a product, marketing begins shaping expectations around it. What symptoms matter, what treatments people request, what drugs people believe they need. This doesn't automatically mean every drug ad is deceptive, but it does reveal something important. The system now contains an incentive to expand the market for treatment. And when treatment is profitable, the definition of treatable conditions has a tendency to grow. When medicine becomes a product, marketing doesn't just sell treatments. It begins shaping the definition of the illness itself. In most countries, doctors introduce medications to patients. In the United States, however, patients sometimes introduce medications to the doctors. When billions are spent telling the public which drugs to ask for, the line between healthcare and advertising starts to blur. This doesn't automatically mean the system is corrupt, but it does mean something worth noticing. The incentives around medicine are not purely medical. They are economic. And whenever economics enter the room, the signal gets a little bit harder to hear through the noise. Next up, regulatory capture. There's a phrase you hear occasionally in political science: regulatory capture. It sounds technical, almost boring. Trust me, I get it does sound boring. But the idea behind it is anything but boring. Because regulatory capture describes something subtle: a moment when the institutions meant to restrain power begin slowly aligning with it instead. And the shift rarely happens all at once. It happens gradually, quietly, until one day the system still looks the same on the surface, but the incentives underneath have changed. The concept of regulatory capture was formalized by economist George Stigler. The idea is simple: regulatory agencies are created to oversee industries, protect consumers, maintain safety, prevent abuse. But industries do not sit passively while being regulated. They hire lobbyists. You've all heard that word, lobbyists. They fund research. They build relationships with lawmakers and regulators, and over time, those relationships can reshape how regulation works. This is where the revolving door becomes important. Because officials who work inside regulatory agencies sometimes leave government and take jobs inside the agencies and industries they once oversaw. Corporate executives sometimes move in the opposite direction, taking positions inside government. On paper, this exchange of expertise can be useful. At least that's the excuse. But it also creates a powerful incentive structure, because when regulators know they may eventually work in the industry they regulate, every decision carries a future implication. And industries understanding something else: regulation is not always a threat. Sometimes regulation can actually protect them. Strict rules can make it harder for new competitors to enter the market. Large firms can afford compliance. Smaller challengers cannot. And when that happens, regulation stops functioning purely as restraint and begins functioning as stabilization. And this is where things get interesting. Because regulatory systems rarely collapse. If anything, they tend to evolve. The institutions remain, the language stays the same, but the incentives quietly adjust. And here's what we know: every system responds to incentives: political systems, economic systems, regulatory systems. When industries have billions of dollars at stake, influence becomes inevitable. And influence rarely announces itself. It shows up as relationships, access, expert consultations, advisory panels. None of these things are illegal, but they slowly reshape perception. When regulators spend enough time inside the ecosystem they oversee, they begin seeing the world through its logic. Kind of like if you stare into the abyss long enough, the abyss stares back into you. That's a similar thought, I think. The industry's challenges start to feel like national challenges. The industry's stability starts to feel like public stability. And over time, the mission changes. Instead of asking, how do we restrain this industry? The question becomes, how do we maintain this system? Regulation is supposed to restrain power. But when regulators and industries share the same incentives, restraint slowly turns into negotiation. The public assumes regulation protects them, but sometimes regulation protects the system itself. When regulators plan to work in the industries they regulate, every decision begins to have a future employer behind it. This doesn't mean every regulatory agency is corrupt. How could it? But it does mean something important. Institutions are not static. They respond to pressure, incentives, relationships. And if those incentives drift far enough from the public interest, the structure of regulation can remain intact, while the purpose quietly changes. And welcome back. For our last segment, we tend to get a little stranger than usual for segment 3. And tonight, we're going to be discussing the shadow people. For centuries, people have reported something strange. Not ghosts exactly, but not quite dreams either. Dark figures, standing in doorways, watching from the corner of the room, moving just along the edge of vision, always at the peripheral. They're often described the same way: tall, humanoid, featureless, almost like a person, but made entirely of shadow. Today, people call them shadow people, but the reports are older than the internet. Hell, they're older than photography, and strangely, they appear across every culture. Now, in modern times, researchers often connect these sightings to a condition known as sleep paralysis. Sleep paralysis happens when the mind wakes up, but the body remains temporarily locked in REM sleep, REM. During REM sleep, the brain disables muscle movement so that we don't act out our dreams. But occasionally, the brain wakes up before the paralysis switches off. And if anybody's ever had this, if you've ever experienced sleep paralysis, please comment in the section below. Share your story, even if it's just a couple sentences. The result, when the brain switches on, but the muscles don't, is a very strange state. Because you're conscious, you can see the room around you, but you can't move. And in that moment, dream imagery can leak into waking perception. Researchers call these hypnopompic hallucinations. People may hear sounds, feel pressure on their chest, or sense a room full of presence. You can't pinpoint it, but you feel it around you. And very often, they report seeing a dark, human-shaped figure nearby. These figures rarely have faces, almost made up entirely of silhouettes. Some witnesses, quite a few, have described seeing a figure wearing a hat, which we'll get into more next week. Others say the figure stands silently beside the bed, and the experience feels completely real. Because from the brain's perspective, it is. But here's where the mystery deepens. Sleep paralysis explains how the experience happens. It does not necessarily explain why so many people describe the same type of figure. A human silhouette, watching, standing by, silent. Here's what we know. Human perception is designed to detect threats, especially human threats. Our brains are extremely good at recognizing the outline of another person, even in darkness, even in partial shapes, even in shadows. When the brain tries to interrupt an unknown stimulus, it often chooses the safest assumption: another human watching, standing close by. And when fear enters the equation, the imagination fills in the rest. But something else is interesting. These reports exist long before modern science. In medieval Europe, people described demons sitting on their chest. In Japan, they spoke of night spirits. In Newfoundland, folklore, the same experience was called the Old Hag. Different cultures, different explanations, but the same experience. A presence, a figure, a shadow in the room. 500 years ago, people called them demons. Today, we call them hallucinations. But the experience itself may not have changed at all. When the human brain cannot explain something, it reaches for the nearest story available: religion, folklore, aliens. The mystery stays the same, only the language changes. Sometimes the unknown isn't something outside our world. Sometimes it's something inside the machinery of the human mind. And that's where the mystery lives, isn't it? Somewhere between neuroscience and folklore, between biology and imagination. Shadow people may not be supernatural, but the experience that produces them is powerful enough to convince millions of people that something was standing in the room, watching, waiting. Until that moment, the body finally moves again. And if you've experienced this, you know how real it can feel. Put it in the comments. Let us know. If it's interesting enough, I'll do a whole segment on it. I'll break your story down. And that concludes tonight's broadcast. As always, links to the articles used will be in the description below. And if you have anything strange or unexplained, put it in the comments. Please like and subscribe and share this with your friends. Until next time, we'll keep listening for the signal.